Good morning. I'm Michelle Young with USF Health, and we're happy that you're joining us today on this Facebook Live. We've got a lot to cover, and we're thrilled to be joined by a couple of our true experts in the field of allergy and immunology, two of our experts in internal medicine, Dr. Richard Lockey and Dr. Dennis Ledford. Thank you both for joining us today.
Thank you, Michelle.
Nice to talk to you. Yes.
Terrific. So we'll get started. Dr. Lockey, I'm going to ask you this first question, and we'll alternate back and forth. And feel free to both of you jump in after the other, because I know with your knowledge, each of you are probably going to have something to add to the conversation. So first of all, Dr. Lockey, people with moderate to severe asthma may be at a greater risk of getting very sick from COVID-19. What can happen, and why are they more at risk?
Well, first of all, there's a question whether the asthmatic per se is more susceptible. We don't know that. Probably, in my opinion, not. But if you are already having respiratory problems with moderate to severe asthma, your asthma is not under control. It adds a element that you don't want to have if you're going to be infected with this COVID-19, because you're already compromised. And if you're already compromised, it means you have less reserve in the process of getting this infection. So my recommendation would be, first of all, make sure your asthma is under excellent control. If it's not, you should see your physician and make sure it is. The second is that I don't think that asthmatics are at higher risk for COVID-19, even though it is a coronavirus, and some coronaviruses can exacerbate asthma. It seems to me, from reading the literature and knowing something about it, that at this point you're not at higher risk. You may be at slightly higher risk because you have asthma, but not at major risk like you would be if you had the COPD or severe heart disease or severe diabetes, et cetera, and you're not as old as in the elderly age group as I am, okay?
Careful, Dr. Lockey. Yeah, and I would agree, and also include the message that people should not stop their asthma medicine, because they need to control what they can control. I mean, there's certain things in the epidemic we can't control. Things happen that we just don't anticipate, but we know that asthma medicine helps asthma, and people with asthma should maintain their asthma medicine and not be afraid to use it during the COVID epidemic.
I certainly agree with that. That's something that everybody should understand, that when you control your asthma, you're probably at less risk of having a respiratory tract infection exacerbate your asthma.
But it's just confusing because in the literature and in the lay press, there'll be discussions about steroids making it more risky to have COVID, but they got to understand that's treating people in a hospital on a ventilator, not using their inhaled medicine to take care of their asthma. And so people shouldn't make that leap between what they might read in an article and what they're doing daily to keep themselves healthy and able to do their daily lives.
So somebody that has asthma should make sure they have an extra inhaler laying around, have some extra medicine laying around while they're at during the stay-at-home orders.
Well, there's a variety of different medications we use to treat asthma, one of which is inhaler you use as needed. Albuterol inhaler, use that as needed when you're having a cough or asthma. But there are medicines that control asthma, and they're the ones that are most important to take, the ones that keep the asthma under control during the whole entire month, the whole entire year. And those medications have gotten so much better during my lifetime, it's almost incomprehensible. The difference between when I started out and Dennis started out treating patients with asthma is so incredibly different, so much better, it's almost something of a miracle. So the controller medications could keep taking them to control your asthma. Use your albuterol inhaler as needed. If you need more of that and more of that, then you need more and more controller medication. That's when you should see somebody like myself to bring yourself back under control. Dennis?
I agree. You don't need them laying around. You need to be using them, and just using them consistently and not changing your regimen that you and your doctor have worked out because of this COVID epidemic. If anything, you should just be more consistent with it so that you don't get your asthma out of control and confuse your asthma cough with a COVID cough. And so you want to make sure you treat your asthma. You can do that during this epidemic. And so you should do what you can do. And that's important.
Yeah, one of the disadvantages asthmatics have, Michelle, is that one of the symptoms of asthma is coughing after laughing, lying down, talking on the phone, exercising. So again, they may be suspicious when they go out go shopping or somebody start coughing, somebody may run away from them. But cough is a major manifestation of asthma. When you're coughing, it means your asthma is coming a little bit out of control. That cough usually subsequently started by wheezing and then shortness of breath. So when you start coughing, it can be a first sign of symptom of having the exacerbation. So it's a major symptom of asthma, cough.
Wow. Okay.
Most people are used to that who have that. I'm sorry, excuse me.
Oh no, go ahead. Go ahead.
I was just saying most people who have asthma are sort of accustomed to that and they understand it, but the people around them don't. And the important thing is the cough from COVID or SARS-CoV-2 doesn't respond to albuterol. If your cough gets better with albuterol, most likely it's your asthma, and you should treat your asthma and not assume that it's COVID unless you have other reasons to be suspicious.
That makes sense. So Dr. Lockey and Dr. Ledford, we'll let Dr. Lockford talk a little bit first. There's so many different articles. I'm so glad that we're with two medical specialists in this area, because some people believe that COVID-19 is a virus that's airborne, and some people have said that you can just get it by breathing or talking. That's how you can spread it. Could this infect someone with asthma who uses an inhaler? And we've already talked a lot about this, but where do you stand on that if you think this is a virus that they could pick up like that?
Yeah, there's no question that this virus is transmitted by cough, by particles that we secrete or cough out of our mouth or nose when we talk, when we cough, when we interact with people. In my opinion, there's absolutely no question about that. Can you get it from secretions on a table, et cetera? Of course you can. But probably the major transmission is due to talking to one another close up, 2, 3, 1. Because when you cough, you can project particles out. Some people say 30 feet. We know it's at least 13 feet. When you talk, you project particles out. That's why if you look at your iPhone, it has all sorts of particles on it, because when you talk in your iPhone, you're seeing them. So the one thing I would tell people if I had asthma, I was going out and shopping, and I tell everybody, wear a mask, use the proper precautions, stay away from people 6 or 8 feet, and if I wear glasses, I tell them to wear their glasses if they have them. And when you get back to the house after shopping, if you think you've been possibly exposed to somebody, take your glasses off, put them in the sink, wash your hands first, then wash your face and wash your glasses, and go back and do what you're doing. You can't in any way totally predict that you're not going to get this problem, because we're human beings and we move around, and sometimes we get inadvertently exposed to things we shouldn't be exposed to. But yes, it's in my opinion, partically transmitted by particles from the mouth and from the nose, secretions.
And I agree. I think the problem is sometimes we as human beings in a stress situation become very anxious, and we're looking for the 100% reassurance on everything. And then we read reports that you can find it on a tabletop if you do a laboratory test to isolate it at 2 days or a day or something after someone's been there. But the reality is this is a respiratory illness spread by droplet or aerosol transmission. And the closer you are to someone, and the more you share with them, and the more they cough and breathe on you, the greater the chance you are to get it. But the reality is you're not going to get it from handling a food item that someone else has picked up. That is just not likely at all. Again, you have to say, could it ever happen? Maybe. But it's not the way it's going to happen most likely. And you've got to take something by faith and sort of assume and go forward and live your life. Otherwise, you just are afraid and don't do anything.
Good. I think washing your hands and social distancing, it sounds like, are the keys to keeping this virus at bay.
Well, I also think key is wearing a mask. If I could tell people to do one thing, that's the thing I would tell them to do. Because, for example, if you have the problem and you have a mask on, you have a much less chance of infecting me. Does a surgical mask help you? I believe it does. I mean, it makes sense because it could keep a particle from going into your mouth, into your nose. So masks, washing, distance, they're the key things.
And I agree with Dr. Lockey, except I think that the paper surgical masks help remind us of being careful, and they help us from infecting others. Whether they protect us, it's not always known, but if we don't know who's infected and who's not, we have to assume that maybe we all are infected, or we all could be infected. So wearing a mask is a way of identifying that we're all in this together, and we're all trying to help each other, and we're going to live together and be civil to one another. And the mask, I think it helps in that sense.
Sounds good. Dr. Lockwood has said that assume every surface you touch, every doorknob you touch has COVID-19 on it. That'll help you learn to wash your hands more often. So,
yeah, Dr. Lockwood is our dean. That's you're talking about Lockey. Lockey would say that also. You're saying
yeah,
Dr.
no, you'd agree with them on that?
Yeah, yes, Dr. Lockey is our dean at the University of South Florida. So, yes, I certainly would agree with him. Absolutely. But he's Lockwood, I'm Lockey, okay? That's all I was just saying.
No, I wasn't mixing you up. I
No,
know the difference.
I know that, but for the people maybe watching, I want to know the difference.
Yeah,
okay.
So we're joined here by Dr. Lockey and Dr. Ledford, and we're talking about asthma and a number of other things, allergies to do with COVID-19. Let's talk a little bit about, let's jump away from the COVID-19 pandemic and talk a little bit about allergies this spring. Are they worse in Tampa this spring than normal? Are they about the same? Are they continuing to get worse yearly? Dr. Lockey, if you can start.
Well, they're always worse. We have an epidemic of allergic problems during the spring of the year. It starts late December, ends up about May 15th. It's an epidemic. What I'm saying to you is we get such high counts from various tree pollens, mainly the oaks. There's 11 different species of oak here in Tampa. But other trees also cause a problem, and they cause allergic rhinitis or hay fever, allergic conjunctivitis, eye problems. They sometimes exacerbate skin problems, and they definitely exacerbate asthma. And we think that the allergens, when you're allergic and already have inflammatory disease in your respiratory tract, you're probably more susceptible to viral infections. So again, I would try to tell people when they're having allergic problems, try to control them. With a theoretical possibility, you may decrease the chance of being infected by some virus, possibly even COVID-19, although there's no evidence on that. Dennis, go ahead and say what you think.
Well, I think whether it's getting worse from year to year, I think that's a point of some debate. There is some evidence that with increasing global temperatures, pollen counts are changing slightly, but we've been having springtime pollen exposures for as long as I've been here, and I've been here a long time. Dr. Lockey a little longer, so it's not new. This is not global warming. It's part of nature. It's normal in the spring that we have this. This year, I don't think was quite as severe. Part of it may have been social distancing and people staying inside. Other things, though, might be the fact that we had a little bit more rain this spring, and sometimes rain will temporarily lower the counts. So there's a lot of variations in the weather, not climate, but the weather from year to year that can make one season a little bit worse than last season and vice versa. So I think it was a fairly otherwise probably normal year from pollen count standpoint, but seemed to be a little bit less symptoms just from my interaction with the patients this year.
My follow-up question to that is, if you have allergies and you suffer from allergies, what are a couple tips, Dr. Ledford and then Dr. Lockey, that you make sure you tell your patients? I've heard always wash your hair if you've been outside, or change your clothes to get the pollen off. What are a couple tips like that you recommend as well?
Well, I think first and foremost is understand the problem. Some people assume they're having allergy when it isn't. Some people think they know what they're allergic to and they're not. And so knowledge is a powerful thing. So seeing a specialist who can actually tell you accurately whether you are or you're not allergic is important. And then using your medicines appropriately. I think, again, control the things you can control. You can't control the beautiful weather in the spring, nor do you want to control it. You love it. You want to be out there. You want to enjoy the weather. You want to live your life. And so I want you to live your life. And I would say use your medicine. All the other things, I think, are sort of way, way down on the list. Does taking a shower after you've been outside, does Does washing your clothes after you've been outside, does all that make any difference? It might make a tiny bit of difference. And if it makes you feel better, by all means, do it. Is it critical? I don't think so. I mean, I tend to be a little bit of maybe a bit nihilistic in some of this, but I realize people are looking for non-medicated ways, non-medicine ways affecting the problem, and it makes sense to avoid what you're allergic to. But unfortunately, what you're allergic to is outside, and I want to be outside and enjoy myself, and I can't do both. So closing your house up in the spring, running your air conditioner in the spring is not what we want to do. We want to open the windows and enjoy it, and so that's the trade-off we experience.
Yeah, Michelle, the other thing that people have to realize is that these are naturally occurring pollutants. These are not man-made pollutants. These are pollutants that Mother Nature puts there at certain times of the year. And most people don't think of a pollutant as a pollen, but it is. It's a major, at times, problem for people with allergic problems at this time of year, and they get very sick from it. But these are naturally occurring pollutants. I totally agree with Dennis. We have such good medications today, much better than we had 30, 40, 50 years ago. And they're to be used, and they're extraordinarily safe. They're not dangerous to use. It's like worrying about a BB gun in a war. It's not going to be a problem. The medications are totally safe.
Good.
Yeah, I have many patients who want organic, and I would emphasize almost all the allergens, 99% of the allergens we deal with are all organic. They're made by the organism, the plant, the animal. They're not man-made. They're not chemicals. They're not things we're putting on things. They're what the plant made. And so organic is allergy because that's where they come from.
Okay, we're going to talk about your passion project together. I know that the 6th edition of the Allergens and Allergen Immunotherapy has gone to press, and if it's not out yet, it's going to be out soon. It's billed as the single source of reference for allergy and immunotherapy. Why is this book such an important tool for a physician as well as a medical student? And we'll start with you, Dr. Ledford.
Well, I joined the party a bit late because Dr. Lockey with Dr. Buchan's, who founded our division of allergy and immunology here at the University of South Florida, started this book. And to have 6 editions speaks, I think, to its legs, its longevity. I think it has filled it has served an important role and filled a need by providing a single resource that really tells you everything that you should know about this thing called allergy immunotherapy or allergy shots or allergy drops or allergy treatment. This is a way of changing the disease and not relying on medicines, but using those same organic materials that we talked about from Mother Nature that provide the allergen to induce your immune system to no longer react to the allergen, to condition you to no longer be as allergic as you were before. It's a remarkable treatment option for people that have persistent symptoms. I'm honored that Dr. Lockey allowed me to join him in this endeavor, and I think this book is the best ever. And it really does cover the problem from stem to stern, and I think the readers would find it very, very useful.
Yeah, allergen immunotherapy has been used in our field for years. Actually, when I started out in this specialty, there were very few double-blind control studies, what Tony Fauci would call scientific evidence for its efficacy. That came about the last part of the 20th century that showed that this kind of form of therapy was very efficacious, used correctly. Now we're using allergy immunotherapy to treat allergic rhinitis, conjunctivitis, atopic eczema, asthma, but also you can give it by mouth, so sublingual tablets. That's usually used for people who are allergic to one particular allergen. And we're now using it for oral immunotherapy for food allergy. We're doing research here at the university, state-of-the-art university, trying to determine whether we can desensitize people by giving an oral food extract to decrease the idea that you are peanut allergic or have a peanut allergy. So it's the first allergy immunotherapy was first used in allergy immunology in our field, and now it's being used in cancer and autoimmunity and all sorts of other diseases. So it was the first of the first, and we're very, very proud of that in our specialty. And this book As Dennis said, it's world renowned. It's used throughout the world and is written by authors from Japan, Europe, and United States, all over the world.
But we also intend to make it relevant and user friendly, and that we did think one of our focus is to keep it the information that's accurate and scientific, and make it such that you can apply it in patient care. And so I think that's another reason I would encourage medical students, even residents and younger doctors and older doctors, if they want to use immunotherapy, want to know about it, this book will provide that background.
So I think it's safe to say the 6th edition, the first was published in 1991. Dr. Lockey's own father started practicing as an allergist back in the late 1940s. I think it's safe to say that the field has changed quite a bit since then, and I think Dr. Lockey addressed that earlier. But if you can talk about one of those changes that surprises you, Dr. Lockey, and then Dr. Ledford.
Well, the changes that don't surprise me, I think I'm very proud of them. We've been part at this university of revolutionizing the care of allergic diseases. As I said, when I first started out at University of Michigan, we had all sorts of people dying of asthma. If a person dies from asthma today, they're either not getting proper care or getting access to care or using their medications. We rarely ever have a patient in our clinic hospitalized, ever. When I was in Michigan, we'd have a whole clinic of patients who were in the hospital trying to get them better, some of whom died. When I first came to Tampa, I had 2 young people die of asthma, and they got the best care we had available at that time. So the thing I would say has changed the most, and we've been a big part of that at University of South Florida in our basic research and our clinical research. We've brought new treatment modalities, including learning how to better use allergy immunotherapy into the field, which has made a horrendous difference in the care these patients get. My comment is that the medical student says asthma is the most treatable of all chronic diseases known to mankind. If you have asthma, we can get you better. We can have you play soccer. We can have you play football. We can have you swim, mountain climb. You can do anything today. It used to be we restricted all sorts of people depending on their severity because they couldn't do certain things. So the new treatment modalities have been revolutionary in our field. Dennis?
I would just add, as far as surprises, I mean, I was thinking, it was a little bit daydreaming, Michelle. I was thinking, you said surprises, and I was thinking back as I edited this book, because it's written by authors that are world renowned, as Dr. Lockey said. So I'm reading these manuscripts from the experts in the world and looking at their perspectives in different parts of the world. To me, though, the thing that's most surprising is that immunotherapy started empirically by clinicians making observations and trying things, and it seemed to work. And it's now been confirmed that it did work when it was done properly, and now we know why. But I'm really surprised that allergy immunotherapy actually changes the course of the disease as much as it does. I think we recognize that when people are getting treatment, they seem to be better. But what's also been shown now is that they're better when they quit the treatment, meaning their bodies have changed through the course of the treatment. And it really does have sustained benefit. And I think that's, to me, quite surprising that when people get treatment, they're less prone to get new allergens in the future. They don't progress in their disease from rhinitis to asthma, and they actually can sometimes stop the treatment and stay better. People with insect allergy can be treated and then stop treatment, and they no longer react to insects years later. And so to me, that's pretty remarkable.
And now we're doing the same thing with food allergy, peanut allergy, tree nut allergy, shrimp allergy, and that's on the horizon. And we should be able to treat that also in the future.
That's great. So in addition to, and I flipped through this book, I flipped through the chapters, and it is a really impressive list of people writing about a variety of different subjects. It's really, really impressive, the work that you have done, Dr. Lockey and Dr. Ledford. Let's wrap up this conversation today and talk a little bit about, you're writing about the history of internal medicine in this book. It appears that we are writing history as we speak about the COVID-19 pandemic. For Dr. Lockey, if you'll speak first, and then Dr. Ledford, what are some lessons that we've already learned that we can apply moving forward in your field?
Well, first of all, I appreciate you bringing up the concept that I wrote a book, I edited a book with another colleague on the history of USF's Department of Internal Medicine. It's a very illustrious history, and we've had great leadership during that. First Dr. Benke, then Dr. Goldman, and now Dr. Sennett. So that history is extraordinarily useful for people to understand. This university has come from a no building university, a medical school, to one of the best in the world now. So we can all be very proud of that. Two is that the thing you have to realize is that science practiced correctly is the only way you make advancements in medicine. Science meaning you have to use a scientific method of finding whether something is right or wrong. One of the examples right now is hydroxychloroquine to treat COVID-19. Does it work? We don't know it works because we still don't have the best studies to illustrate it does work. Could it work? Yes. Hopefully it will work, but we don't know if it does work. So you have to have, and people, the layperson individual doesn't understand this. Scientific methods are very important to make advancements. So too, for example, is animal research. The idea that animal research is not necessary in this day and age is so naive and really so incredibly stupid, it's almost unbelievable to me. But a lot of people think that somehow you can use the computer to do this kind of research and all that. You cannot. We need that. The most fundamental thing right now for COVID-19 is animal research. Second, taking that animal research observations to humans. So that's been something that's a pet peeve of mine, the idea that somehow we can somehow eliminate them from the armamentarium that we do. We use animals in our own research, and it's enabled us to make all sorts of advancements as we've gone forward.
And I would say, picking up on the theme of history that Dr. Lockey alluded to, USF's history, I think COVID-19 is a reminder that we as human beings are part of a history of human beings. And epidemics have been part of our history since time immemorial. This is not new. I think we have gotten insulated in our present time of thinking that this doesn't happen anymore, that people don't get paralyzed from polio, that people don't die from yellow fever or chicken pox, or smallpox, that this doesn't happen. In reality, you can see that biology changes all the time, and these kind of things are going to happen. It's inevitable. And the thing that helps us is, I think, using common sense and what we do know, and not panicking, and trying to help each other, and doing the right thing, and not just running here, there, and everywhere, trying to find some quick answer. And without vaccinations, allergy immunotherapy is a vaccination. Without vaccination, we will not completely lick this problem. We need the vaccine. Now everybody wants the vaccine. 2 years ago, I'd ask you to get the flu shot. People say, oh, I don't want to get the flu shot. It has side effects. I've heard some people get sick from it. I don't want to get it. Now suddenly, everybody wants the vaccine because there's a problem. Problem goes away, they'll say, well, I don't know if I want the vaccine. And so without vaccines, we don't make any progress. But vaccines require research, require animal research to prove efficacy before we can give them large numbers of people. So remember history. History does teach us about the future.
Yeah, one more comment to what Dennis said. There will be other epidemics. This is not the last of the epidemics we're going to see. And so for the future, you have to maintain science in medical centers, science in pharmaceutical centers, and those different groups have to have the ability to carry forward what we're doing right now with COVID-19. Respond to the threat, come up with a treatment, and come up with a vaccine. And to do that, you need to have scientists, very highly educated scientists, like we train here at the university, very good drug companies to do that sort of thing. And you also have to have the correct animal models to do this, to accomplish those goals.
Let me ask you a final question on that. Will we need to get the flu shot in addition to the COVID-19 shot? Will there be two different vaccinations that we'll need to be getting on a yearly basis, and then those vaccinations will change based on how it develops?
Well, we can't predict. I mean, I certainly can't predict the future. I'd like to be able to say I can, but I can't. But I would imagine they're going to be separate vaccinations because these will be things that will continue to circulate in the community. So like influenza doesn't go away, it changes from year to year, but it kind of stays with us. I don't see any much evidence right now that this virus, as opposed to the Middle Eastern one, which seemed to kind of just sort of disappear for some reason. We're not the Middle Eastern, but one of the coronaviruses seemed to disappear. But this one probably is going to be circulating amongst us for the foreseeable future. So I would assume that we would all get a vaccine for it, plus influenza, plus your tetanus booster, plus your pneumonia vaccine, plus your shingles vaccine. So all these would be separate vaccines that we would be continuing to need.
Now, one comment also is that the things that have made the major difference in how long we live and how well we live, what are they? Good, clean water, taking care of our sewage, taking care of our garbage, good food that we're able to eat on a regular basis, not worry about what is contaminated, common sense activities in a lifetime, not being on a motorcycle going 120 miles an hour down the pike, and equally important are vaccinations. And people denigrate vaccinations, and they shouldn't, because they have made huge differences. What did they wipe out in my lifetime? Polio, measles, chickenpox, smallpox. I mean, it's incredible what they've done for our population. At the turn of the century, in 1900, when my father was born, he lost a brother from diphtheria. I mean, think about that. So we made huge advancements, and people should take advantage of them and understand how important they are.
I agree. And allergy immunotherapy is a type of vaccination. It doesn't work exactly the same way, but it does affect our immune system, and it really helps people with allergy. And vaccines are the way out of this current epidemic. And I just hope that we can get to it as soon as possible, but it's going to take a lot of hard work.
Terrific. Well, thank you both for joining us today. I know USF Health has a number of things they're working on in conjunction with Tampa General in the COVID-19 area. So fingers crossed that something could come from here. But thank you so much. Thank you so much to both of you for joining us. It's been a real pleasure to talk to you.
Thank you, Michelle.
Thanks, Michelle. Thank you.